Ulcers are open sores that develop on the lining of the stomach or small intestine. They are caused by a breakdown of the protective barrier that normally lines these organs, exposing the underlying tissue to stomach acid and digestive enzymes. This can cause pain, bleeding, and other symptoms. Types of ulcers. There are two main types of ulcers. Peptic ulcers, these are the most common type of ulcer, and they can occur in either the stomach, gastric ulcers, or the small intestine, duodenal ulcers. Peptic ulcers are often caused by a bacterium called Helicobacter pylori, H. pylori, which can infect the stomach and cause inflammation that leads to ulcer formation. They can also be caused by taking nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin or ibuprofen, for long periods of time. Esophageal ulcers. These ulcers occur in the esophagus, the tube that connects the mouth to the stomach. They are often caused by acid reflux, a condition in which stomach acid backs up into the esophagus. Esophageal ulcers can also be caused by certain medications, such as bisphosphonates, which are used to treat osteoporosis. Symptoms of ulcers. The symptoms of ulcers can vary depending on the type of ulcer and its location. However, some common symptoms of ulcers include burning pain in the abdomen or chest, nausea and vomiting, loss of appetite, weight loss, bloating, black, tarry stools, a sign of bleeding. Diagnosis of ulcers. If you are experiencing symptoms of an ulcer, it is important to see a doctor to get a diagnosis. There are several tests that can be used to diagnose ulcers, including upper endoscopy. This is a procedure in which a thin, flexible tube with a light and camera at the end, endoscope, is inserted down the throat and into the stomach and small intestine to look for ulcers. Barium swallow. This is an X-ray test that involves drinking a liquid containing barium, which coats the lining of the stomach and small intestine and makes ulcers visible on X-rays. Stool test. This test can be used to check for the presence of Helicobacter pylori bacteria in the stool. Treatment of ulcers. The treatment of ulcers depends on the cause of the ulcer. If the ulcer is caused by Helicobacter pylori infection, antibiotics will be prescribed to kill the bacteria. Other medications, such as proton pump inhibitors, PPIs, or histamine H2 receptor blockers, may also be prescribed to reduce stomach acid production and promote healing. If the ulcer is caused by NSAID use, the doctor may recommend switching to a different type of pain medication or reducing the NSAID dosage. Lifestyle changes for ulcer management. In addition to medication, there are several lifestyle changes that can help to manage ulcers and prevent them from recurring. These include eating a healthy diet. A healthy diet includes plenty of fruits, vegetables, and whole grains. It is also important to limit fatty, spicy, and acidic foods, as these can irritate the stomach lining. Quitting smoking. Smoking can slow the healing of ulcers and increase the risk of recurrence. Limiting alcohol consumption. Alcohol can also irritate the stomach lining and increase the risk of ulcer recurrence. Managing stress. Stress can worsen ulcer symptoms. Relaxation techniques, such as deep breathing and yoga, can help to reduce stress and promote healing. Taking over-the-counter medications. Over-the-counter antacids can provide temporary relief from ulcer pain. However, it is important to talk to a doctor before taking any over-the-counter medications for an extended period of time. Prevention of ulcers. There are several things that can be done to prevent ulcers, including avoiding H. pylori infection. This can be done by practicing good hygiene, such as washing hands frequently and avoiding contact with contaminated food and water. Taking NSAIDs with caution. If you need to take NSAIDs, it is important to take them as directed and for the shortest possible time. You may also want to talk to your doctor about taking a medication to protect your stomach lining. Quitting smoking. Limiting alcohol consumption. Managing stress. If you have any questions or concerns about ulcers, please talk to your doctor.